ground.
We gotta keep you. So, when I was last here, we were doing the electronic tutorial, and we actually got some people to participate, and they did. Did they say anything to you later about that?
The COB students.
No, when I was just here with this computer, and the patients came up and actually punched the button and made it advance. Did they say anything to you later about doing that?
Yeah, Professor, I'm sorry, I'm not getting you at all.
Yeah, this, and the tutorial was on it. Let's see if I can bring it up.
Yeah, I'm trying to get, actually.
Let's see if I can just bring it up and we can. I turned this off to save the battery.
The time was to show patients tutorials, and they were punching for themselves.
And then we gave prizes. Remember, you gave
Oh, yes, exactly.
awards.
So, Julia, I would like to know what happened after that. What feedback did you get from it?
Actually, yeah. They actually loved the health talk very, very much. They appreciated, and they actually felt or request. I know they requested you for if they had something they could be hearing on, like the health education talk, preventive measures, and so on. Which right now at least we've got, in several languages, including the local language.
Yeah. Did you play the Japadola for them?
We did play the Japadola, yes.
And how did that work?
They actually appreciating.
And
Excuse
do,
me?
do you feel like it gets their attention more when it's in Japadola?
Yes, it gets their attention very well.
Great,
Yeah.
great.
Yeah.
Now, have you noticed, and I realize we haven't gone a long time with this, but have you noticed any differences in terms of people coming in with malaria? Do you sense that they're learning anything about preventative measures, or do they understand that malaria comes from the mosquito? The things that we were thinking about before. Do you get any sense that there's progress there, or are there more things that we can do?
Actually, from the people themselves, we are really getting. Okay. We are. So maybe if you could come.
Yes. Really close.
Yeah, thank you.
Yeah, actually, even from when we played the a tape for them, or the CD, and after that we actually stop at times and ask them, have you got any message from what you've just heard from the TV? They really say yes. And then when we ask them some few questions that maybe the CD was not asking or would not have asked, they actually say, I would say it helps us to know that they have understood, and at the same time they are practicing what they are actually listening to, and then whatever was not said from the CD, they request to know from us in detail. Yes.
That's great. That's great. I was our students, our COPE students, had a conference this week on malaria in Kampala, and they did a great job. But one thing I learned at that conference that I didn't know was that Tororo district is the second highest in terms of malaria in Uganda. Only a patch is higher infected bites per night. So you are really sitting in the middle of a highly malarious region. What do you think is the best thing to do? I mean, people come here and they bring nets, or remember you said that the nets really didn't have any effect at all. People come here, they bring tutorials like ours, posters. What do you think will make a difference?
Yeah, actually, from what we've got from the community, we felt that majority, okay, what is really the biggest problem is poverty. Yeah. They say we can use nets fine, but we can't afford have all the children under the same net, and then we can't afford all the nets for each child. Yeah. So it's really a real problem in the preventive measure.
And when they hang them in their homes, how did they do that? Is it easy to hang one of those nets? And for people to get under it, do people sleep on mats or do they sleep in beds, or how does it work?
Actually, it's easy for them to hang. That's very easy because at least just a matter of telling them what to do, and then they tie to the poles and what, and then tucking down under the mats.
Okay.
Yeah, but of course we tell them always that if they sleep too close to the nets, automatically the mosquito will bite them. But the problem is that 2-3 children in one single net, automatically they will have to crawl up the sides.
Right.
Yeah.
And I guess if there was a big net, they could make poles. I don't know. What do you suggest? A lot of people think nets are the answer, and I'm just trying to see what you think.
Yeah, actually, we also try to tell them about maybe getting to the house before it is really late, and then maybe wearing some long dresses or clothes with long sleeves. But then it really doesn't work in the community because they are at times very busy in the evening. And by that time, that at least they say close the doors, they are still busy cooking. Yeah.
And it's hot too.
It's hard.
And it's very hot, literally hot, isn't it, to sleep in clothes? You know, if I were to sleep here in these clothes.
Yeah, especially when we are not used to.
Yeah. And I was wondering too, do you feel like people understand that the vector is the mosquito, or are there still a lot of misconceptions about the vector?
No, people do understand right now.
That's great.
Yes.
Because that's a big first step.
They do understand it's the vector, the mosquito.
Are there other things that would be useful or helpful? I realize poverty is a big piece of the problem, but are there other things you think might work that no one has brought in or suggested to you yet?
I think another thing is just continue medical education. I mean, health education on prevention. Yeah, continue. Because as we go to the outreaches, still you get some few who have other belief that maybe flies and so on. But when we talk to them, you find, you ask them, the others tell them, no, it's not flies, it is not what. So if we continue giving them health education on preventive measures, I think this is very helpful.
Yeah. How many patients do you have here who come here? Do you have any sense of that? A number?
Yeah, an average of 50 right now per day.
And some of those people come back, but some of them are new. So is that roughly, trying to do my math, do you have like 1,000 patients a month? Or, is that right?
Around average of 600 to 1,000.
Oh,
Yeah, a month.
and what do most of them, what is the problem with most?
Actually, right now, the most, let me say, the highest surveillance is still malaria. But just because many come on initial cases, and then are from very many places, not really within our catchment area. Yeah.
because it's such a good health center.
Yeah, they hear of.
They hear of you and they hear
Yes,
of
please.
drugs. Yeah, yeah. When they have malaria and you give them medication, do you show them how? Do they take a dose before they leave the health center, or do they go home and take the first dose?
No, the first dose they take it right from the health center.
Great.
Yeah, and we do encourage them to complete the full course. Because without completing, we really tell them that it will have to be a recurrent problem. Yeah.
What is your feeling about DDT spraying?
Yeah, actually DDT would be also one of the best. But to our communities, I know it is just a little bit expensive. Yeah.
So the community would have to buy it?
Yes, they would have to buy it.
So the ministry isn't doing that, or the district isn't doing that?
Not really.
So has any spraying been done here at all?
Within the catchment area of the
Yeah.
communities, not yet. No.
Well, that will be interesting when it finally happens. Are there people here who feel, do they want it, or do people feel negative about it, or they don't know, or how do you think people feel?
I think they would really appreciate, because their main problem is the illness caused by that mosquito.
Mm.
You know.
And what are the health problems that you see?
Their health problem, actually the surveillance, what I would call weekly surveillance, is on malaria leading right now. But as I said before, that most of them actually are coming from several sub-counties within the district. Yeah.
Do you see any other diseases like diabetes or hypertension or things like that?
Yeah, hypertension, diabetes, and things like that are not very, very common, apart from maybe acute diarrhea that is always after a side effect of babies with malaria and so on.
Mm.
Yeah.
Mm. And do you feel there are a lot of people in the community that don't come in, right? They don't come to the health center. They go to other healers, or what are their options if they don't come here?
Yeah, maybe what I would think is just because maybe someone would lack money to come to have the little, I would call a small fee for service. But otherwise, they all do come. Because from the health education in the communities, they really get that it's dangerous to have that mosquito or bite and then have the child with temperature or an adult or what, and then keep with it in the community. Yeah, they do rush to have at least treatment for that.
Good. And is Bernard still doing your health education?
Yes, he is.
Great. Great. Yeah, I've got photos of Bernard doing that. And what about men? Do men come here much? There were a few men the day that the last time I was here.
Yeah, men do come, especially maybe, okay, I should say, mostly accompanying their partners. Yeah.
And what kinds of illnesses do they have when they come because of their own illness?
Especially maybe if you talk of cough, something chronic.
Yeah.
Yeah.
Do they, is malaria more prevalent in the women than the men, or the children than the men?
More with the children and the female and the female adults.
Well, we were talking on the way over here, we were saying how, because the malaria, it never stops here, right? It's always, there's always malaria, right? Or is it seasonal? Does it come and go? Or?
Yeah, sometimes we realize actually that during harvesting season, we get more people with malaria, maybe because of the breeding grounds. Yeah. But when it's a bit dry, no, we get very few cases of that.
Because it seems like a very low-lying area, and I'm sure the water would accumulate easily when it's here. Do people, is diarrhea a problem as well?
Yes, it's a problem. Because they lose a lot of water. And of course, when they have both malaria and then with the acute diarrhea, it's quite a big problem.
And do they come, do you have little kits for them, for the ORT?
Yes, we do.
Because I understand that it's safer for them to get the kit from you than to try to make it themselves.
Yeah, it's safer, actually, because of contamination.
Yeah, because if they put
Sometimes
bad
they
water.
use unclean containers, and then the dilution may not be very okay. The measurement, sometimes there are no spoons at that moment.
Right.
Yeah.
And I remember when the students were here, they went out, there was some diarrhea coming into the center, so they went out and looked at the water, and people were, they weren't using the boreholes because boreholes would get broken, and then the person who would fix it would then charge them for water. Is that what I remember?
Yeah, that was true actually. That time we went around, we found several boreholes down, and then the well would also dry up with only mud.
And do they make their own wells? And do they use those instead of the boreholes, or do they go to a stream, or what do they use for getting water?
Actually, they use borehole, but when it's down, they go to the well. Yes.
And what is that water like in the well?
It's just sort of simple protected wells. Maybe they dig up, then they leave where the water will be flowing, and then here they put some trees where they can protect it from maybe children falling in or themselves where they will be standing.
Yeah, or animals or whatever walking through. I also heard something I was dying to ask you about, that there was a policy against using the clay pots for water in favor of using the jerry cans, because the plastic jerry cans were considered to be safer. Can you tell me more about that?
Yeah, I think it's, you see, actually when you talk of a pot and a jerrycan is not easily broken.
Yeah.
But all pots may break easily, and then cleaning them, of course, you need to, they are very delicate, such that they may not be very clean. Much as you would want to really swing it to make it very clean, it may not be very, because you have to handle it very carefully. But with the jerrycan, this is something plastic, so you can really clean it very, very well.
So you think jerry cans work pretty well?
Just because the way you can handle them is different. The other one is very delicate, but this one is very simple.
Yeah.
Yeah.
You know, another thing when I was here the last time, remember we talked about the mats? You remember this. Dr. Joshua Okoff had made a mat that was treated in some way. And maybe when we're in town, we could at least give him a call. Because he was the one. Do you know Dr. Joshua?
Yes, please, I know him.
Because when I talked with him a couple of years ago, he said that he had made a mat that deterred mosquitoes, so they didn't have to sleep under a net, and it could be made with local materials. And each time I'm here, it's hard to track him down, but I will try tomorrow or today to see if I can get in touch with him and find out what that was. If you had one wish for the health center, or maybe a few wishes, what do you think the most pressing needs are in terms of having better health in Mifumi Village?
I think maybe from what we've also discussed about the mosquitoes, the well, and then maybe the health education. Yeah, I would just think if we have any other better way, like having more health education, I mean educating materials, or something that can help us go to the community wider, or something like that, and that can teach the community better. Yeah, and then also of how we can really protect these wells and so on. Yeah.
So maybe something for the schools, or some outreach into schools. Would that be useful?
Pardon, Professor?
Something into schools, some education that can be done in the schools, health education.
Yeah, which is very good because from the children they will carry to the parents very easily.
And you think that's a good way for parents to get the information?
It's a very good way.
The other thing I noticed here, one night I came out, it was the end of the day, I came out of the health center, and there were people sitting all up and down this road, and I wondered why they were here. And someone told, and the men were on one side and the ladies were on the other side, and someone told me that there was going to be some kind of health film or some sort of film, and that they'd come for that. Is that a big attraction? Is that a good way to?
Yes, it is, because once you see something, you believe in it more than if you are told. When you see it physically, you see it on something really happening with your own eyes, you learn from it more than when I tell you. So it's something very good that you don't forget.
Yeah, people have a lot of memories of even the old days, you know, when there used to be films that came in on trucks, and people would go down to watch the films. Now, I know people enjoy that. Do you have any sense of what difference it makes for them in terms of changing their behavior?
Yeah, Professor, I think what you see, especially when you see something, you really believe in it. And it's very possible because it really affects you. You really get it deep in you. So it's very possible that they can change their behavior from seeing the films and so on.
Do you have a sense that films do that better than the CD that we sent, or posters or books?
Now the films would do better, but then even the CDs would help because they can see, but they will need someone to tell them again, really. Yeah.
Yeah, did you get, after we went through the computer with them last time, did you get any feedback from them on that activity? Did they say anything after I had left?
Yeah, they were happy because they tried themselves.
They liked that.
They liked it. Yeah.
I remember Bernard was a little bit hesitant about them trying, and I said, well, all they have to do is, you know, punch the one button and they can advance it. And they did. They got right in there.
Yeah, which was very good because they were proud, they were learning. They were learning to do something, and we were very happy with what was produced from the screen.
Yeah. How do you think that's different from a poster? Hanging up a poster.
The poster actually, they also see and learn from it, but from the screen as they were pressing, They also learning actually, but they felt they were doing it for themselves.
Ah.
Yes.
So there was some engagement that doesn't happen with paper.
Exactly.
Yeah. What do you want that would be useful? We're working with some folks at Gulu Medical School. They want to make a tutorial like that on mental health for teens. And also, remember when we were here before, we talked about nutrition. And that was so helpful that you and your colleagues told us about nutrition. And I keep hearing new things every day that people believe. I heard yesterday that women don't eat chicken. What do you think that's about? Why is that a belief?
That belief was there. It was just a kind of, okay, in the olden days, sort of a respect for maybe men, that they should have a better chair, and then maybe something like, okay, to me I thought it was something being partly greedy, because there was nothing really bad with women eating, but because the men saw it sweeter than maybe meat and so on, so they felt it would be really sweet, better for them than the women.
That's what I had understood. And another thing we talked about, I think, was poor people don't. Only poor people eat greens. Was that one of them?
I think that comes only because you may not be able to afford, but they too also can eat other things, but just simply because they can't afford.
So greens is the only thing they can eat.
Yeah, you can
Yeah.
grow and eat, really.
And the planting, we talked about how people could grow soy or some other things in order to get protein and more balanced diet that would help them be healthier. Do you notice, or do you talk with people about what they eat, and do they tell you what they eat, and what do you think of what their diet?
Yeah, they really do tell us actually. But then we found out that from what they tell us, sometimes they just don't know what and the amount they should eat. But they do have all this balanced diet, except that maybe just where the time to eat this, or how to eat it, or to prepare it, things like that. But otherwise, all these are grown, except the eating. Because you may find someone having beans, maybe peas and so on, but may only sell it for other things. May not have known even that it is something like proteins. Yeah.
So, once again, it's a financial consideration as well. Now, I've never visited the drug shop in the trading center. What is that like?
The drug shops in the communities.
Yeah.
Actually, the drug shops in the communities are just simple drugs.
Uh-huh.
Yeah, that is allowed by the drug authority. Otherwise, there are drugs that antibiotics are not allowed to be in the
So they sell Panadol?
Panadols, then maybe just other painkillers, actions, and so on, aspirins and so on. But then you may find also a drug shop that is having some other antibiotics, but not freely. The person may not freely sell them because he knows it's not supposed to be sold from the drug shops.
Yeah, I guess if you buy things from drug shops, you don't know if they're fake drugs or real drugs.
Yeah,
Is that a problem?
It's a very big problem because some drug shops keep them for the sake of having money, but not for the sake of maybe expiry date.
Yeah.
It went sometimes maybe even 4 or 5 years, but they still have the tins. Yes, they still have the tins. Yeah. So So it's a little bit difficult really. And then they may not explain to you the full dosage. They may not explain to you what to do next when you find a problem with the very drug you are taking. So that's also a big problem.
Or if you're taking the right drug.
Exactly. You see, the point is, most people who go to drug shops have what they want in their mind. If I want aspirin, I just come to you, Professor, do you have aspirins with you? You simply release the aspirin. You want to ask me, are you taking it for headache, or you cut your leg, or what is paining? No. I just came to you, Professor, may I have some chloroquine? You simply give me chloroquine and off I go. Yeah. So I don't know whether that chloroquine you are taking for an adult or a children or who. You gave me 100 for chloroquine, I've given only 2. What's 2 going to do for you? For babies or who?
So people are diagnosing themselves.
Actually, with the drug shop, you have to diagnose yourself before you go to a drug shop.
Now, do you have traditional healers around that people go to as well, or they?
We have traditional healers, yes, and people do go to them, but it's not very, very common right now.
You know the survey. Remember the survey that the students did. It seemed like your health center had enormous credibility. You know, I didn't notice anybody getting a lot of information from, you know, drug shops, traditional healers. They seem to mostly come here and trust the information that they get from you. But is there some positive role that traditional healers play in the community that's different from the health center?
Yeah, quite a very big difference, because the traditional healers may not really go deep asking about the history, how it started this, but they simply say, yes, I know what's happening with you. Yes, maybe your grandfather who died some years ago are doing this and that. So actually they just want to get something right from you, like maybe money. So you come and say, such and such a thing is maybe something that happened sometime. So I can help you with that. And even the drug they're going to give you is not going to help you, because, for example, if a child is convulsing and this child is rushed to the traditional healer, now he will not ask about, he will not bother about the convulsions, but will tell you it is your fathers who want a goat, something like that. So unless you bring here a goat, you sacrifice, but the child is dying with convulsions, terrible temperatures high. So by the time you realize this child is dead, and maybe dead from malaria, the goat has gone, you have nothing to do again. It's terrible.
I've heard sometimes that people say, well, when you go to a traditional healer, they'll spend a long time with you, and that's, you know, a positive thing, whereas people might walk a long way to get to the health center, and of course not this health center because you're always here, but to see a doctor, say when Dr. Ojok comes through, and then he sees them very quickly because there are a lot of people waiting. Do you see that as do you feel that people in the community go to the traditional healers because of that, or because they have more time, or?
I feel people go to the traditional healer because of just beliefs, and these beliefs were actually before much of health education had taken in the community. Yeah, but right now that health education is helping. You find people really trying to balance, let me say weighing. If I go this way and I go this way, which one will help me better? Why don't I go to the doctor first and then I'm told maybe this and this is like this? course, most of them from the traditional healers do come to the health center and get better after staying there for 3 days. Yeah. 3 days, there's no change on the baby. Then they come to the health center and the child, the temperature is gone.
If you can't help a child here, do you send them to Royall Hospital? Or
Yes,
what is the next step?
immediately we send them to health center for, or like where there is severe anemia. It depends on the cases we send.
Yeah.
Those that have to go to health center for, we send them to health center for. And those that we see the life-threatening, need a baby blood transfusion, which is not in the health center for, we send them immediately to the hospital. Yeah. So we send them where necessary, actually.
Yeah.
Yeah.
And how do they get there? Well, first of all, I guess, how do they get to you? And then how do they get to health center for transport?
No, the problem is transport actually. But then to us, they come on bicycles, most of the majority, and on foot also. But then when it comes to referrals are quite far. So they have to look for ways out, like maybe they go and park there a few things, or if it is emergency, we request them to try on their bicycles until they can reach the nearest hospital. Yeah.
So there's no ambulance or service that can help them get there. They need to get there themselves.
Unfortunately, at the moment, we don't have that as yet. So they still struggle to get to the health centers in that way.
Yeah.
Bicycles or even on foot.
Yeah. Yeah. And how far, how many kilometers is the health center for?
Health center for is about 13, 14 kilometers from here.
And then from health center 4 to Royall is...
From health center 4 to Royall is quite a little bit far actually. About some 18, around there.
How long have you been here, sister?
I've been here since 2001, May.
And what were you doing before you came here?
I was also a nurse somewhere. Yes, please.
Is this your home district? Or?
Yes, it's my home district.
And you live close by?
Pardon?
Do you live near to the center?
The center?
Yeah.
I live to a health center.
Yeah.
I live within the health center.
Ah.
Yes.
So do you receive people 24 hours if there's an emergency?
Yeah, emergencies we work throughout 24 hours, and then maternity deliveries. That is also 24 hours. Otherwise, something that is not very urgent, an emergency, we request them to come the next day. Yes.
Do you ever get rest?
Yeah, we do get rest. Though short, but we do get rest. Yeah.
You have a good staff.
Yeah, we do have staffs. Right now we have a midwife, Zara, with me. Yeah.
And where did you train to be a nurse?
I trained from Zambia Hospital in Kampala. Yeah.
And what course did you take for that?
I took a registered nursing. Yes, please.
And had you always wanted to be a nurse, or was that something that you just decided on after you got out of school?
I've always wished to be a nurse.
Yeah.
Yes.
You still like being a nurse?
Very, very much so.
And how many years have you been in nursing?
Since 1990.
Oh, yeah. Almost 20 years.
Exactly. Almost, yes.
So, is it you like being able to work in your home district? Is that?
Yeah, I started actually from other districts, but I felt I should come back near the home district too. Yes.
So you know these people?
Yeah, I can speak fluent Gapagola. I know them actually. I should accept. Admit, yeah.
And you know their families, so you know if you were to see some sort of heart condition, you might remember that a parent had that condition, or grandparent, or something like that.
Yeah, being a native, I know the kind of life they lead and how I can also help in the kind of life to change also, try to help to change. So I've stayed with them for some time, and it's very possible that when I wish them, let me say I help, especially health education, I know the kind of life they lived and the kind of life they can change to by better health. Yes, please.
Well, that's a vision that we want to support in any way that we can with these health materials. You know, there are a lot of people making educational materials, and someone was asking me back in Washington, do the folks on the ground, like yourself, think these materials are going to make any difference, that they're going to help at all? And I said, well, I don't know. I'll have to ask. So immediately I thought I must ask Sister Goretti if she thinks they're going to make any difference, because you must get a lot of things that come your way, and I'm sure you're very polite to people. And I hope that you would tell us what you think works and what doesn't work, you know?
Yes, Professor. I will be able to think and see what would work, more especially on health education material, as you say. That's very okay because it is possible you can change life, behavior change, yeah, to a better, healthy life.
You know, the Japadola was one thing that we did, and that was so much fun that day when we started the translation. And I remember there was some kind of argument the word itself, and whether it's a colonial word or, you know, what, how did the Japadola word for malaria is what?
Actually, from what we had here, since when you were here around, some were thinking it was nyanginya, but then nyanginya in your actual sense would mean something that would make you a bit weak. It really described maybe the joint pains, the fever, the word nyanginya in itself. So that was the real problem that came around. Some people were having some other things, but then we came to a conclusion. It was nyanginya. Actually, it is a combination with symptoms and signs and what all together that made nyanginya. Nyanginya in itself is something that has really made you very weak. The joints are paining you, you are feeling cold, fever, something. So, yeah.
It's really, it seems so interesting to me to think of how, if you want to make a difference in health, you must know what the local people are calling the symptoms. You know, what they call it. Like Burkitt's lymphoma, for example, is something I know that's prevalent, especially in the north. But what do the people call it? They don't call it that, probably. They probably call it something else. And unless we know what we're calling it, then we can't get very far with the education part.
Yeah, it is true, because sometimes when someone comes and says Misuja, in Misuja it itself, I would translate it back to English, fever. But then fever has malaria fever. Other illnesses have fever. So when you say Misuja, to local people in the community, they have already framed it to be meaning the running nose, Misuja.
Like a cold.
Yes, a cold. But meanwhile in English it is fever. Translated back to English it is called fever. So when you ask them, now you're talking of Misuja, what do you mean by Misuja? Okay, how is it going in you? Because Misuja is a general word. Then the mother is able to tell you, you see what I mean by Misuja, that child is from the child I saw, the running nose, and then maybe sneezing. Because she was meaning like this. And otherwise, if you don't really ask stress, then Hamisuja may even mean tooth pain, what? Several other things. Unless you ask, yes, you have told me Misuja, but what have you really seen that is making you call it Misuja? Then she will explain, then you're able to get from what she's meaning.
Yeah.
Otherwise, many of them talk of Misuja. What is Misuja?
Because the treating people for presumptive malaria, just because they have a fever,
Exactly.
is what causes all the drug resistance. So it sounds like you have a protocol in your mind of how to get to what it is.
Yeah. Yes, even currently people just come and tell me my child has malaria.
Yeah.
Oh, so your child has malaria. But what did you see that made you say malaria? Because me say that word malaria in English, but doesn't know what it is properly. I say, oh, that's malaria, yeah. But what is it really you see? See, the rash is here, and then the nose is there, and then this. So you come to know, okay? You have to explain again back. Because she has already called malaria or something else. Yeah.
I have so much respect for you in working with people to find out what they're thinking rather than just what they're saying. And another thing that I learned too recently is that the malaria tablets, I guess there's some clinics that just give them. They don't actually make them show the patient how to take them. So they take them home and take them however they can, but also that they can make young children vomit. And it just seems like to give it at the center, then you could see whether or not they're vomiting the tablet. And how do you cope with that when they vomit the tablet? Is there another way to treat?
No, with vomiting the tablets, at times they simply fear taking the tablets or anything bitter.
Yeah.
But sometimes because we give them the start doses, all the babies, so we tell the mothers what to do. Now when you see the child is trying to fear, get hold of the baby very nicely and then try to mix and then give. We actually tell them what to do at the start dose. Then I will tell them, hold on, just wait a bit. And we always see many mothers, the children don't vomit. But when you tell them, you see most of them believe injection would help them than tablets. But then we want to convince them, tablets can help better than injections because to some extent, when they swallow it, it will help them actually better than these injections. So when at home, they can take the tablets, but they are not going to take the injections. So it is a little bit difficult. If we told them it is the injections better than the tablets. When they are taking home, the tablets, take painkillers, maybe Septrin and so on. Those ones they take tablets, they don't take injections. Yes.
Speaking of injections, do you ever give quinine injections?
Yeah, in complicated malaria, we give a start dose, and in most cases, and refer. Yes, but in uncomplicated malaria, we don't give any injections.
I've heard of several cases. A friend of mine has a son who got an injection of quinine at Malaga, and the person giving it didn't know exactly what they were doing, or they made a mistake, and he's got a foot problem. Have you ever had any difficulties? You probably know exactly what to do.
Yeah, at times, especially from drug shops, at times you get children with those problems. Yeah, the mother comes maybe 2-3 days and says, this child is not able to step down with this leg. But what happened? She may say that, okay, she may begin from somewhere else. But just she wouldn't really want to tell you exactly that yesterday I took the child to the drug shop. But then when you continue asking her, then she told me the other day I took, but when after the nurse had injected, that child was not able to step down. So at times we really ask them really, maybe it could have been a wrong injecting site, something like that, especially with the quinine. Yeah.
There was one other thing I was wondering if you would explain to me, since we don't have it in our culture. We don't, it's not a dominant thing in our culture. Although certainly some people in some places might believe in it, but the whole witchcraft idea, do you get a lot of people coming here who are sick because the parents say they've been bewitched? Do you get much of that?
Actually, Professor, by the time they come to the health center, they've already left out, but because they don't want to mix the witch doctor, plus the nurses. So it's just from some other history that you will know that this person has been at the traditional healer because he was believing this was a witchcraft. But after some time, after some treatment, and maybe it was on a review or a follow-up, you find this person recovering. Then later on would tell you, you see, I thought I was bewitched, and I went to the witch doctor. I stayed there for maybe 2-3 weeks, but now you can imagine, I just came here 3 days and I'm out. So that belief is there in the community, yes, very, very much so. But they wouldn't be very free to come and start it at the health center that I was at the witch doctor or I've been bewitched. No.
Is there a lot of practice of people putting stones on other people?
Okay, from stories we do hear that. We do hear that, especially something that we hear of. We call it in our local language sikoko. Sikoko is something people believe they can throw from your behind, and then it enters your body, and then makes you feel a little bit. Then you could feel the shoulder pain. You see very, very you get severe pain on the shoulder, then to transfer or move, radiate to somewhere else, and then maybe backwards, and then something like that. Yeah, that belief is there. But at times, the belief may be there, but it could be only simple malaria that has caused you. But then because you also heard of something, like maybe sikoko, and then before you go to the health center, you will have thought of, maybe this is sikoko. Then you try traditional healer, but the sikoko doesn't go because it is malaria. Yeah. So when they come here, they automatically come and then explain to you. Then later on, you will hear that person revealing, maybe I tried also traditional healer because I thought it was sikoko, but nothing was found, or they found stones. When they removed, they found stones or bottles, but it continued paining me. And after 2-3 days, the person feels better after the malaria treatment. And I would like just to appreciate the tape, the Japadola version, very, very much, because it has really helped the community, the patients, and so on. Some people just leave their place and then come and sit inside there behind the patients to listen to the malaria version, except that the only challenge we have is that to some extent it's not really directly Japadola language. Yeah. When it is, the health educator talks it over the TV, some words amuse patients. It's not directly what we know. And then they keep on, that person is talking what? Oh? They ask such a thing. Yeah.
I see. Okay.
Yes, please.
So, we probably need to know what those things are so we can make it even better.
Yes, thank you.
Thank you, Professor. You are teaching me. Thanks. And thanks to
Every year the children are very many.
Yes.
So we're trying actually to begin with them. We're trying to make them space so that they can have some strength. And then with that strength, they can also look for something to educate those ones now. Yeah, from the ground level.
But you know why they
But are
do
they
that?
spacing?
You know,
Are
you
you
know why they do
realizing
that?
that?
Yeah, right now they're getting the message. They're trying to space. There are those even who have chosen the natural. Maybe just doing something, as Doctor was saying, and then maybe counting and so on. Those who are able.
Is that with the doesn't it create family? Isn't it creating?
What? And when you begin from maybe taking pills or injectables, then one person is going now to prostitution, because now if she doesn't deliver, she'll have several men, something like that.
she
So
knows
from
she,
the
because
community-
they fear to get pregnant. That's why they will not go out with
Don't
several
get
men.
unfaithful.
Yeah,
This
they can't
was
get
sort of-
unfaithful.
From the beginning, we wanted both couple, actually the couple to consent. The man also has to know. But then we realized that
Men are more
it was not really helping, because the men were saying now, that is the story. You want our women to begin loving other men because they will not
Yeah.
conceive.
And
Now
then
when we
and
went
then
to
the,
the condoms for the men, they said, what? So that is the thing you are now telling our men to begin going out. They didn't want the condoms for their men at all.
but it's okay to come with HIV.
Not really.